Why are there so many tobacco stores in poor areas? That's what it comes down to, is why is the smoking rate higher in low-income areas? Why is it the communities where we have more people of color, more people with low income, that's also where we see tobacco stores on top of each other? That's been an effort for the last 6 years that our community agency Youth Leadership Institute undertook. These youth really had a passion for figuring that out and, more importantly, solving that. So over years they collected data about this density of stores. That's how they framed it. They put together these awesome maps that show where the dots are. They determined they really wanted to do something about it. They didn't want to see the Soma Tenderloin district having 180 stores, Chinatown having 180 stores, and meanwhile, like in the Sunset, there's only 37 stores. So for some reason, even with the same population, it's tale of two cities. So they took a whole bunch of actions, collected tons of community support, continued to do really good research and get some very dedicated leaders on board so that they could push this, and unanimously it was adopted an ordinance that puts a cap on every district on how many stores there could be. So now in San Francisco, every district has kind of a maximum future cap of 45 stores. What eventually really moved the density ordinance forward is something we never would have envisioned at first. It was partnership with tobacco retailers. It just was making unusual partners. But the idea of meeting up and partnering with business, that is not the norm in public health. So I thought it was an amazing win for young people. It never would have happened without our young people moving forward with the support of the Department of Public Health. The other effort that we've recently undertaken is around e-cigarettes. You think about the 1940s, the adult smoking rate was about 45–48%. So literally half of adults were smoking 60 years ago. And now in San Francisco, we're seeing something like a 13% adult smoking rate, so it's quite a lot lower. But now there's new products like electronic cigarettes that are really causing us a lot of concern because they do carry nicotine, they do have these great attractive flavors, they're becoming extremely popular, and that means there's a new generation that's getting hooked in kind of a sideways way to tobacco products. Each year we see essentially a doubling of youth use of e-cigarettes, so we realized 2 or 3 years ago this is becoming an emergency. We were definitely the first city in the United States to adopt a public education campaign around e-cigarettes. We ended up calling it our Curb It campaign. It basically educates young people and adults about e-cigarettes. It informs them that the tobacco industry owns these products. There's a lot of questions about the health implications of e-cigarettes. It talks about flavors of e-cigarettes and that kids are getting hooked, more and more kids are using them. It talks about the law in San Francisco and says e-cigarettes are cigarettes for all intents and purposes. And e-cigarettes are still so new, there's no way we could know long-term effects on anybody's health. E-cigarettes have only been around for 7 years, so there's not any long-term, no one has been a long-term user. So there's a lot of questions there. For that reason, San Francisco Department of Public Health keeps educating, keeps talking, which isn't a problem for me.